Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the pharmacology of the metformin. What is metformin? Metformin is an oral hypoglycemic drug. There is an anti-diabetic agent. It is the only available biguanide available in the United States of America. So, what are the mechanism of action of metformin? Metformin decreases hepatic glucose production by inhibiting gluconeogenesis by activating adenosine monophosphate stimulating protein kinase. What is gluconeogenesis? Gluconeogenesis is the process of formation of glucose from sources other than carbohydrate. Metformin slows intestinal absorption of sugar. Metformin improves lipid profile, so the triglyceride level will be decreased. Low density lipoprotein will be decreased. Very low density lipoprotein will be decreased, and HDL will be increased. It increases peripheral uptake and utilization of glucose. It does not promote insulin secretion, but it is an insulin sensitizer and decreases insulin resistance. Metformin does not cause hypoglycemia and does not increase body weight. So the mechanism of action is continued. Metformin decreases plasma glucagon level. Glucagon is a hormone coming from the alpha cells of the islets of Langerhans of the pancreas. Metformin often decreases body weight because of loss of appetite. Metformin decreases cardiovascular mortality. It decreases incidence of cancer like pancreatic cancer and other cancers. Metformin is considered as an anti-aging drug. How? It maintains body weight, does not increase body weight. It decreases cardiovascular mortality. It decreases the incidence of cancer. That's why it is also called an anti-aging drug. Metformin prevents diabetes in high-risk patients, especially middle-aged patients or patients with metabolic syndrome, patients who are obese. This will work among those people. Metformin restores fertility in ambulatory women with PCOD, that is polycystic ovarian disease. Idea is that metformin increases the sensitivity of insulin. Metformin helps to get ovulation in those women with PCOD. In this way, it restores fertility. It can be used alone or in combination with other anti-diabetic drugs or with insulin. In that condition, doses may be adjusted according to the combination, according to the blood sugar level. Pharmacokinetics and fate of metformin. Metformin has a half-life of 1.5 to 3 hours. It is well absorbed from the small intestine. Metformin is not bound to plasma protein and is not metabolized. The highest concentration are in the saliva and intestinal wall. It is excreted unchanged by the kidneys. in the urine. Metformin may cause lactic acidosis in a patient with renal failure. In the United States, metformin use is not recommended at or above a serum creatinine level of 1.4 mg per 100 ml in women and 1.5 mg per 100 ml in men. Adverse effects of metformin. It causes nausea, diarrhea in around 20% of patients. Continued use of metformin will decrease the nausea and diarrhea. Lactic acidosis, especially in patients with liver disease, kidney disease, alcoholism, patient taking heart failure medication, chronic cardiopulmonary dysfunction. In that situation, there will be lactic acidosis, or possibility of lactic acidosis is high in this situation. Long-term use of metformin may cause vitamin B12 deficiency. How? Vitamin B12 absorption requires intrinsic factor, vitamin B12 and calcium. This is the calcium-mediated absorption from the ileum of the vitamin B12 plus the intrinsic factor. So in case of metformin, that calcium-mediated intrinsic factor vitamin B12 absorption in the ileum is disrupted. So person may develop vitamin B12 deficiency. Metformin should be discontinued in patient undergoing diagnosis, requiring intravenous radiographic. Okay, so contrast dye. So it should be discontinued at least 1 day prior to the intravenous radiographic contrast dye. Contraindication of metformin for diabetic patients who are susceptible to develop lactic acidosis, in severe infection, and also in pregnancy. In pregnancy, it may be little bit teratogenic to the newborn, so to the fetus, so it is not indicated during pregnancy. Doses of metformin. Metformin may be started with 500 mg tablet or pill. Maximum dose is 2.5 mg per day. Dose may be decreased if taken with other anti-diabetic drug or with insulin. Serum creatinine, glomerular filtration rate, and mean corpuscular volume need to be assessed periodically because there is chance of vitamin B12 deficiency anemia. There may be large RBC, mean corpuscular volume will be large. Drug interaction. The effects of metformin may be enhanced or potentiated by cimetidine. This is an anti-peptic ulcer drug. It works on the stomach. In case of peptic ulcer, this is a very good medication. Furosemide is a diuretic that may also cause it's the enhancement of the metformin may be done by furosemide, that is a diuretic. Nifedipine is a calcium channel blocker, and all these drugs will enhance the effect of metformin is enhanced by all these drugs. And that's all about the pharmacology of the metformin. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.